Hello everyone, welcome to your practice today. This class is designed primarily to help you relieve tension and pain and discomfort from your body. It's going to include some regular standard yoga postures that we normally do in our classes, but the main key is that I'm going to invite you to approach your movement from a different perspective. I want you to think about today's class all being brain training. So pain and discomfort can arise in the body from many different reasons. So whether it's some habitual posturing, it's an injury, it's an old injury, surgery, or even this sort of emotional armoring where we hold tension in the body when we have anxiety and stress and such. So whatever it's from, what can happen often, what does happen often is that we get something called sensory motor amnesia, where the muscles just forget how to relax or to contract in a specific way. So rather than simply approaching a rebalance of the body through stretching and strengthening, which are also important aspects, we're going to really take the approach of awareness today. So in a sense, retraining the brain to have intentional control over activating and releasing the muscles as you need them to. So a lot of attention, a lot of awareness. If you're brand new to the practice, if you've never done yoga before, that's okay. I'm going to offer a lot of modifications, and if I don't give you something that works for you, feel free to skip parts or feel free to change the pose as you see would work for you. So we're going to go ahead and get started. Just get a comfortable space on your mat. If you don't have a yoga mat, a comfortable space on a floor that feels okay, or even lying on a bed would be okay. You're going to come onto your backside. And so important to note when you're addressing any sort of discomfort, or even if we're coming from a rehabilitation or prehab standpoint approach to the body, it's really key that we address the trunk, the torso, and the breath first, and then we travel out into the extremities. So today's class is going to be primarily about addressing what's happening in the apex of the body, the trunk, and then we'll have subsequent classes that address the upper extremity and the lower extremity. So make sure that you're comfortable lying on your backside. You can keep your knees bent as Dave is right here. Close your eyes down and just start to invite in a sense of relaxation. That can be challenging at times, but one of the primary aspects of bringing our body back to balance is inviting in this increased parasympathetic response, hopefully encouraging our brain set to come out of that sympathetic, muscular overactivity tone that tends to happen. And so as you're here, just begin to slowly expand your breathing a little bit. Don't work too hard to do this. And I would say that's the entire class. I'm going to guide you through some movements and actions, but try not to overwork, but just enough. As you expand your breath, notice where the movement sensation, so feel and sense where your body's moving according to the inhale, according to the exhale. So a lot of times when we're in that sympathetic state, the stress state, we'll send our breath increase, especially more into the clavicles, the collarbones, into the shoulders. So here I want you just to direct the breath downward. So sensing breathing through the bottom portions of the lungs, having a lot of effect on the belly space. Trying to minimize the movement in the shoulders and the collarbones. Every time you breathe in, the diaphragm is going down and out, going into the abdominal space. So you can start to feel that density change in the belly. Now as you're taking the breath lower in toward the abdomen, notice now the very front points of your ribs. You might even place your hands there for a moment. And notice if on the inhalation, if they flare forward at all. It's called a hinge pattern of breathing. So notice if the ribs are hinging forward at all. And if they are, just encourage them to get a little more still. So sort of snug them into the body. Again, not working too hard. And you might notice if you made that shift, that will direct the diaphragmatic momentum even more down into the belly space. So as you do this, I want you to begin thinking of circumferential breathing. So breathing all the way around the front, the sides, and even the posterior side of the waist. Breathing all the way 360. And again, dialing into subtleties today is going to be really effective. We don't need big, huge actions to happen. I think that's sometimes the mistake we make in a lot of physical formats. We want this big, dynamic firework action to happen, but I want you to tune it way down and dial into subtleties. Take 3 more breaths in this way, this circumferential downward breath. And just let your brain have a moment with it. Your brain can really start to register what's happening here. And once you get through those breaths, just let your arms relax beside your body. If they're not here, you can even have your palms down to the floor to offer a little bit of grounding, a little bit of support. Continuing this breath pattern, trying not to let it go. And we're going to add in the slightest movement of pelvic rocking. So it's sort of like a cat-cow movement that we often do in class from our hands and knees. So as you breathe in next, you're going to let your tailbone sort of tilt forward and down toward the floor. So you're arching your back a bit. And then as you exhale, it's the opposite rounding. So just the opposite of what you did today. So as you breathe in, arc the back, tilt your tailbone forward. And then as you breathe out, flatten the back of the pelvis, the lumbar spine into the floor. And just continuing this really subtle movement. Close your eyes down. I want you to tune into some of the muscular action that's happening. So getting the brain to be more intentional with movement here. So as you arc the back and breathe in, I want you to feel the tightness of the musculature in the low spine. So it's the spinal erectors. And feel that connectivity all the way up to the neck, the back of the neck. And then as you breathe out and you do the opposite, as you're taking a posterior tilt, as you're rounding the back, pressing the back into the floor, notice the release and the elongation of those same muscles. So getting the brain to, on purpose, tighten the muscles as you inhale, tilting the pelvis forward, and getting the brain to slowly release that contraction, tilting the pelvis the opposite way. Just continue this really simplistic action, inviting the brain to be right in the heart of what you're doing, the heart of the musculature that's contracting and releasing. So oftentimes we'll go out throughout our day with these lumbar erectors really, really tight, and we've lost all control because there's a sort of sensory motor amnesia happening there. They stay tight. So instead of stretching them, it's nice to just wire the brain to on purpose let them go. So that's what you're doing here. Just go through about 3 more rounds, really slow with the breath, breathing in, breathing out, contracting, releasing. You might notice as you contract the backside, the abdominals, the front side gets long and looser, and vice versa. As you lengthen the backside musculature, the abdominals shorten and activate a bit. Once you get through your last round, when you're there, just let your body go passive. So just let your pelvis go neutral, let your breath go in whatever direction it needs to, let all of that sort of land in for a moment. Let a couple of breaths move through. Just notice what you feel. So we're going to pay attention to balancing the musculature between the abdominals and the back muscles. Oftentimes one or the other overpowers, or they sort of struggle for dominance. So we're going to get balance between the front and the back. We're also going to eventually start to look at these cross patterns in the front and the back of the body. So imagining an X on the front of the body and an X on the back of the body, and just sort of feeling how the body works dynamically in full body movements and actions in a more functional way. So from here, as you're ready, you take your hands behind your head. So now we're going to address more actioning from the front side of the body. Really simple action. Just keep in mind, this is not a crunch. It's not a sit-up. So you'll take a long breath in, elbows kind of wide here. And as you breathe out, tucking your chin to your chest, take your lower ribs toward your pelvis, your front hip bones a little bit more, so you're crunching in. Then as you inhale, slowly, in a controlled way, releasing the abdominals. And repeat that. So as you exhale, tucking the chin, taking the ribs toward the pubic bone, that's contracting the rectus abdominis. And then see if you can release in a really controlled way. Controlled, so intentionally getting the brain to regain that control. And you'll repeat that. Just keep going several times using the breath, engaging the rectus abdominis, getting really tight in the abdomen. And then a control, slow release. So as you're doing this, I want to speak to the importance of that release. So it's that eccentric action as you're controlling the release. You're not just quickly releasing the abdomen, you're slowly releasing the contraction. That way you get the brain's attention. So slowly releasing will get the brain's attention, and it will help the brain to regain control of releasing the musculature as you decide, rather than all of the automatic patterns keeping your body tight and bound. Keep going a little while longer. One more thing as you release the contraction slowly, notice any little jumpy, jerky actions where it's hard to do it smoothly. Those are indicative of little pieces of sensory motor amnesia that I'm referring to. So if you find it hard to release smoothly, the contraction, just start over and just keep working towards smoothing that contraction out so you're regaining conscious control. Couple more. Again, balancing the musculature of the front body and the back body so they're not struggling to support the spine in a nice and even way. Once you're done there, just let your body relax for a moment. Move your arms however you need to. Feel your breath wherever it needs to go naturally here. So tuning in to breath pattern. A little reminder to yourself to not over-effort these actions. Inviting in that parasympathetic approach to the practice. All right, layering in one more movement from this direction. Release, so similar hand setup behind your head. We're going to start with feet on the floor. I'll give you options to change this if you want to from here. So now we're going to address these cross action patterns of the body. So again, a big X, think of it going from the front of the shoulder, through the pec, through the middle of the body, through the opposite abdominals, down toward the hip. So X, cross and cross. So from here, keeping feet on the floor, with your right side, you're just going to gently lift up. So sort of like the roll up that you're doing, but right pec toward left hip. Lifting up, little squeeze across this line of the body. Same controlled release, looking for those little jerky, ragged moments in the release, keeping the breath fluid. Stay on the same side. So you're going to keep repeating this right shoulder, pec to left hip engagement. Remembering that release, the eccentric part, the releasing out is super, super important because that's where you're reminding the brain, let's regain control of how the body is tightening and actioning versus it being subconsciously tight. You're going to go 5 more times the same side. If you wanted to lift your legs off the floor, that's going to up the strengthening part of it a little bit. You don't have to, but that's one option to feel something a little different. And you could even, as you come across, draw the left knee toward the elbow just a little like Dave is here. Again, not overworking, placing a lot of importance on that eccentric release. Going slowly with the breath. Remembering to send the breath downward circumferentially around the waist. When you get done there, you can totally relax and rest, getting through your 5 rounds or something like that. Just letting your body go. Let the ground have your body for a moment. Let some natural breaths move through. And just a reminder, if you're going through these actions and you meet pain, I want you just to move in your pain-free range of motion. So if you're meeting pain, don't go into that space. Come out of it a little bit. Change it as needed. All right, slowly coming into the next side. So just setting your hands back behind your head. Again, starting with feet on the floor. So we're working the opposite sash, the front cross of the body. So left shoulder to right hip. You want to lift enough to feel that engaged line. And if it's hard to feel, close your eyes down. Imagine this line working. This is often referred to also as the anterior oblique slings of the body. Really important when we look at full body functional movement in our everyday, walking, running, throwing. And so tightening the line on purpose and releasing the line on purpose. And so just continuing, as you do this, I want you to start to get a sense of when you tighten the front line, the diagonal line, simultaneously you're releasing and elongating the matching line on the back side of the body. If you wanted to move into that legs off the floor, you can, or you can keep it just as it is. So somewhere about 5 more. If you need a little more, a little less, just kind of tune into what you're feeling. You might start to draw the right knee a little more toward the left pec as you cross the body. Make sure you're not yanking on your head or neck. As the front body line engages, this oblique line, the matching back body line is getting a stretch, a release. And then when you're done with those, you can just relax again. So a really important stage of all the work is letting the musculature completely relax. And this complete relaxation, even getting the brain, like as if you're just brain training here, let your brain notice, right now I'm choosing to completely relax my muscles. You might scan through your body and see if you can sense any tight spaces holding on. I was just telling Dave, one of the things I love about those float tanks, I don't know if you've ever done one before, but the sensory deprivation salt tanks, float tanks that you go and lay in. And it's really cool because you can sense the parts of your body that are holding tension without you knowing it. So maybe you can find a sense of that here. Take a couple more breaths. And then from here, when you're ready, you just hug your knees in a way that feels good, rock around a little bit, just noticing and sensing what you feel in your body, and moving into a child's pose from here when you're ready. So one of our more standard postures that we do in practice, taking your knees wide toward the edges of the mat will give a lot of space for respiration to happen through your belly, through your ribs. And if this pose is not attainable, it's often because of just the range of motion in your ankle, knee, or hip, and that's okay. If you just lift your hips up higher, you could give yourself a little more space. And if this pose doesn't work at all, as I mentioned, skip it, do something different. Just taking this awareness now of the balance between the front and the back sides of the body, these interesting functional lines, the X on the front side of the body, the X on the back side of the body. Just with this awareness, taking a couple of breaths here. And then adding in a little bit of movement as you breathe in, just lift up. So like you're lifting toward a tabletop position, and then as you breathe out, go back. And so as you're doing this back and forth, just send your attention to the front of the hips opening as you come forward, backs of the hips kind of shortening a little bit, and then as you go back, the opposite happening. And just doing this again as a brain training, so just getting your brain to pay attention to what's happening in the body. Go back and forth a couple more times. A reminder of this downward and outward, using the diaphragm to take the momentum out of the shoulders, out of the collarbones, sending it down into the belly. Eventually make your way just to hands and knees, so tabletop position. And then coming into more of a full movement cat-cow as you breathe in. Do that anterior pelvic tilt that we did earlier on the back. So letting your tailbone go back, chest forward. And as you breathe out, round. Really slow breath, really slow movement. I want you to find your full pain-free range as you go back and forth. And as you inhale into cow pose, notice the tightness in the spinal erectors, the backside muscles, and then a slow release of them as you go to cat rounding, noticing if there's any jagged, jerky movements. Continuing, noticing the interconnectedness. So as you're engaging the back side of the body, the front side of the body is releasing. As you round, ribs toward pelvis, engaging the rectus abdominis, releasing the backside. Do one more round. All with the intention of bringing your body back to balance through the training of the brain. The muscles only do what the brain tells them to do, whether that's conscious or subconscious. And so any return to balance has to involve this sort of brain training. So from here, making our way into downward facing dog. Those of you that know it, go ahead and go. I'm going to give some detailed alignment in case you're new to the posture. So from this hands and knees position, you can take your hands forward. I'll be going through some detailed alignment. Dave's already in it. If you want to take a peek, so you spread your fingers wide. I have mine kind of wide toward the edges of my mat. I think a little wider than shoulder width distance is good. Tuck your toes under, and then from there, you're lifting up into just an upside down V. The weight of your head hang. If this is too much already, you can tell, just tap your knees down to the ground. This is puppy pose, so keeping a diagonal line in your arms, your spine. If you're doing down dog and you're new to it, it's important that you don't let a lot of weight load into the wrists, the elbows or shoulders. So you kind of bend your knees, draw your hips back. So you can elongate the spine, a sense of elongating the armpits. And then give your head a little nod. Let a little traction happen, gravity work. And just take one more full inhale breath. One more long, slow exhale breath. And you'll make your way to the top of your mat or to meet your hands. So it's getting there however you need to, slowly walking, coming up. Look at your feet and set them about hip width distance apart. So for a nice, even stance. And then rise up slowly, come all the way up. Take your arms up for a moment, extended mountain pose. As you reach up, just this sense of drawing the ribs down into the belly as we established earlier, and just take a few diaphragmatic downward breaths, so that circumferential breathing space, trying to send the breath into the sides and the back of the waist. And then eventually let your arms rest beside your body. And so just establishing a little bit of spinal organization here, which is really important when we're addressing the apex of the body for balance. So starting with the head, take your tongue and place it at the roof of your mouth, right behind your front two teeth. And really that's just a focus point of awareness. So tip of tongue to the roof of your mouth, right behind your front two teeth. And then from there, translate your chin back. So it's like you have a little headrest behind your head. And you're unraveling any forward jutting of the chin. So translating back, I like to imagine I'm carrying a little square pillow on the top of my head, nice and light. So balancing it there. And then from there, take your hands on your front lower ribs. You're just going to remind them to draw down and in so they're not flaring forward and doing any sort of hinge breathing. So drawing them down and in. Take your hands, one on the front and one on the back of the pelvis, and just draw your tailbone down a little bit so you can feel the back extensor muscles elongating just a little bit. And holding that, take your arms up, take a big inhale breath. And then take your hands together through your heart center. Step your left foot back. We're taking crescent lunge here. We're actually going to take a modified version, so it's back knee all the way down to meet the floor. And just shift around until you're comfortable here. And so as we go through this, sending some added attention to the posterior X, that sling in the body. And we're gonna mostly focus here for a moment on the left hip to the back of the right shoulder blade. So as we do this, just try to remember to keep the diaphragmatic breath going. And take your left hand, so you're gonna take your arms forward for a moment. And I want you just to draw your right arm back. So sort of like a bow and arrow squeeze. So it's here, so it's elbow back, you're keeping your chest forward. And what I'd like for you to feel is an activation of the right shoulder blade as you draw it back, connecting down to the left glute engaging. Is that making sense, Dave? Do you feel that? Okay, so as you breathe in, just let your arm come forward and you're gonna let off of your left glute a little bit. So you kind of round like you're going around a beach ball with your arms and then squeeze back again. So right back shoulder to left glute engages and then let it go. So you're just gonna go back and forth here, engaging and letting go. And the idea is to get your brain to intentionally engage this line from the back of the right shoulder to the left glute, and then to intentionally let it go. And remember that as you're engaging the backside diagonal line, the matching front side is getting released. You might feel that for a moment. Front side is stretching as the back is engaging, and vice versa. Just training these functional lines of the body to activate when needed and to release on command. Just getting the brain back in tune with the patterns. So we're going to go a few more rounds. Your option to stay doing it just like this. If you want to tuck your back toes under, lift your back knee up. If it's feeling okay, you can do that coming here. So just bringing a little more dynamic action here. So squeezing back, left glute squeezes, right shoulder squeezes. Then as I come forward, I'm actually going to bend my back knee a little bit, hugging that beach ball. That helps release the back glute a little bit more from the standing position. Do a couple more rounds, little pause. And remember, you're looking for those little jagged edges when you're releasing. Those are little signs of sensory motor amnesia. Trying to smooth those out is where the neuromuscular training comes in. When you get through your rounds, just gonna step to the top of your mat, getting there however you can. Stand in equanimity again, just as we established in the very beginning, even through your feet. Ribs down, circumferential breathing, a little head rest, little touch of the tongue to the roof of the mouth. Big inhale breath. Big releasing exhale breath. All right, from here, take your feet a little wider than hip width distance apart. We're just gonna bring what we've been doing into some dynamic, full body action, which is so incredibly important when we're retraining the brain. So from here, hands just come in front of the body, and all we're gonna do is reach with the right hand as if you were trying to reach something up there on the shelf. So I'm gonna reach up and away, and then slowly come down. And then we'll just go the other way. So a little added emphasis as you reach like you're reaching something on the left with the left hand. Look at your left toes, let it come up on the ball of the foot. So it gives you a little, your pelvis is gonna twist a little bit, and then do the other side. So as you reach, right arm up, left shoulder draws back, come onto the ball of the right toes, and then go to the other side. Incorporating the breath. So as you're reaching to a particular side, as I'm reaching to my left side with my right hand, I'm gonna see if I can feel the activation of my right glute and the back of my left shoulder. So as we were doing earlier, you feel that, Dave? So as you reach with the left hand, right shoulder squeezes back, left glute engages. Oh, so good. And this going, and take the same approach of intentional contraction. Just notice where you feel it. Maybe focusing on these back lines of the body. Intentional eccentric release when you get there. Notice the little jagged moments where you can't release so smoothly. I notice my glute wants to hold on even when I'm switching to the other side. And then when I release it, it's like one big release really quickly. So see if you can slowly release the glute when you change sides. I shouldn't. This is super important. These are really super important patterns when it comes to just gait, walking, which we do all day long. Let's go a few more times. This feels really good to me. This is something I'm eating lately, but it feels really good to my low back, around my sacroiliac joints especially. Let's go one more time each direction. Breathing with the intention of relieving tension, relieving pain. Moving with the intention of bringing more easefulness to your body. Just pausing for a moment when you're there. We'll get that lunge on the opposite side. So left leg is forward this time, your right leg will go back. So we'll start all the way down on the knee. And just to mention, if it's hard for you to put your knee on the ground, you might pad it, you might fold your mat, put a blanket under it, cushion it as needed. And so the leg that's down, so we're going to start with focusing on this from the back of the left shoulder to the right glute. So arms can just reach forward for a moment. You can start this bow and arrow, pull back with the left shoulder. So I'm feeling from my left latissimus dorsi to my right glute. And then as I breathe out, I'm going to reach forward, intentionally, slowly releasing that same back line. And then continuing left shoulder blade to right glute, trying to release it in a really smooth way. It's really easy for us to get sucked into the idea of working hard, doing this as a really, physical exercise, which there's some of that involved, but keep in mind, brain training is slow. Slow gets the brain attention, fast tends to be autopilot and can totally bypass that brain attention. So you can keep doing it like this. If you want to add in a little more dynamic action, you can tuck your back toes under, lift the back knee up, and continue from here. And again, for me, I'm noticing how smoothly can I release that action of the shoulder blade and the action of the right glute squeeze. Can I do it in a slow, controlled manner, or does it want to go pink and let go all at once? Dave? Actually with my glutes, it's hard. It's like it wants to go pink. And so I can tell I do have some sensory motor amnesia there because it's really hard to release in a smooth, controlled way. Notice what's happening with your head placement, your breathing, so important. Just go a couple more rounds. When you get done this time, instead of coming to the top of your mat, we're just going to turn to the side. So standing in sort of a big X pattern, letting your toes just sort of track outward with your knees. We'll do that same reaching for the top shelf action, but from this wide stance, just to bring in a different sensory experience. So starting with hands forward, I'm just going to reach left arm up. I'm going to snug my right shoulder back, finding engagement through my left glute onto the balls of my left toes, and then the opposite reach. If you want to kind of play with this, I was playing with it earlier, and it's kind of fun to go different levels. So go more low, you can go even higher. You might play with how you're sending your gaze, and I'm starting to move a little too fast, so if you're like me, slow down. Slow gets the brain's attention. Fast grooves us right into those already automatic patterns. So back and forth a few times here. Notice when A line on the back side of the body is engaging, one diagonal line, the matching line on the front side of the body is releasing. And then once you're done from here, I'm just going to ask you just to find your way eventually back to a child's pose. So you're just going to come down, come to your knees when you're ready, and go slow. So again, slow gets the brain's attention. I'm going to keep saying that throughout these courses, but just sink your hips back, move in slow, feel your hips closing in the front, feel them opening in the back. Take a big inhale breath here, down into the belly, and a big long exhale breath. And from here, slowly make your way to a tabletop position, coming forward. And then just come on to lying on your belly. So you're gonna go all the way down to meet the floor. Take time to make sure you're comfortable here. And I'd like for you to take your, let's do left cheek on right hand. So you're just gonna be laying here, Dave, so it's like this, and then your left arm just beside your body, just resting there. So even more added attention to these lines on the body. So for Dave here, from the back of his right shoulder, connecting all the way down to the left hip. And then this matching line on the front of the body, and then from the left shoulder all the way down to the right hip. These lines, these myofascial connectivities tend to work together in dynamic movement. They tend to tension and pull together. So if there's a deficiency in one part of the line, it could very well cause discomfort or pain in the opposite side of the line. So feeling something in your right shoulder could be due to what's happening in the left hip and vice versa. Okay, so from here, we're going to be replicating what's called Landau's reflex, which is when an infant just starts to lift their head and look up from their belly. So starting here in this position, you're going to keep your arm down, your right hand down and your left arm. All you're going to do is lift your head and look up to the right. Again, finding your pain-free range of motion, not forcing it. And then slowly coming down. So that's the action we're going to repeat a few times, lifting up and back. And I want you to see if you can sense, as you lift your head up, if you can sense your left hip engaging as you do this, that diagonal line working. We'll progress this, layering on. So if you meet a variation that doesn't work for you, just stay back, don't progress. So now we'll progress this to actually lifting the arm with the head. So you're going to lift up, keeping the back of the hand glued to the cheek. See if you can feel your left hip engaging, and then slowly going down. So you're engaging this sling from the right shoulder to the left hip. You might really feel keep doing this one. You might feel the lumbar spine really working. You might only be an inch off the floor, that's okay. But feel the on-purpose tightening. And then can you release really smoothly? Trying to detect any jagged or quick release moments and noticing those may be indicators of a little sensory motor amnesia, so retraining those pieces. Now, a little add-on from here. You can rest for a moment if you'd like. So we're adding on a lift of the left leg. So really getting into that diagonal posterior sling from the right shoulder to the left hip. So as you lift, looking up, lifting the left leg, even if it's just an inch or two. And that's the repetitive pattern we're going to do a few more times. Remember the release, the lowering is super, super important. I'm noticing the same pattern. My glute wants to release all at once. So a slow release of the contraction is key here. Go about 3 more times. Noticing how you're using your breath here. When you get there, just come into whatever comfortable position works for you. If you take the opposite ear, that's fine. If you want to rest the arms in a different position, that's fine. And here in this moment, really important, see if you can invite that musculature that was engaging to really let go. Like you're telling the brain, okay, now we're letting the muscles go. That's what the brain forgets how to do when we've had a past injury, emotional trauma, surgeries, accidents in the body. Feel your breath come in right here. Feel your breath go out. All right, setting up the opposite side now. So we'll take the right arm back to rest beside the body, cheek to back of hand, right cheek to back of left hand. And the first variation is just lifting the upper body, looking back and up, leaving the arm on the floor for a sec. So you can leave the hand down, Dave, for this first round. And we'll layer that in a moment. Look for the sneaky trap of making this really, really hard, working too hard. You just want to do enough so the brain senses the contraction. And even more importantly, the brain senses the letting go. Look for jagged releases. Let's do one more round without the arm lifting. And as you're ready, if you're going to progress, you don't have to progress, but if you're going to, the arm lifts off the floor, hand stays glued to the cheek. And just see if you can sense as you lift what's working in the back side of the body. You might notice as you lift, the right glute engages a bit. It's like that functional line just wants to work naturally. If you're going to layer on from here, if you want to progress, you would lift the right leg as you lift the upper body, as you look up to the left simultaneously. Remember, you're finding your pain-free ranges of motion. And the release is super important, getting the brain to, on purpose, let go of any tension it may have been holding in this line for who knows how long. Brain training here. Let's go 3 more rounds. Using the breath. Dave's taking a little extra pause in between the actions, which is really good. You let the body come into the eccentric action and then really drop in before going to the next one. All right, when you get through that, get as comfortable as you can for a few breaths. Immediately shifting into sending the breath downward, that circumferential breath, the breath that reminds us to increase that access to the parasympathetic part of our autonomic nervous system, to put on the brakes to the stress-inducing aspect of us. And just roll over onto your backside from here. When you're ready, just roll on over. I'm just starting in a really similar position that we began the class in, feet about hip-width distance apart, where it's comfortable. What you defined is the gentlest posterior tilt, so it's pressing the lumbar spine and the pelvis flat into the floor. You can keep your feet on the floor. So eliminating the gap between the pelvis and the floor. And then from here, just a really simple bridge pose. So you're going to slowly lift, sensing the glutes working as you extend the hip open. Just meet your pain-free range of motion. Diaphragmatic downward breath here all the way around the waist. You'll just take 3 breaths here. Your third exhale breath, you can just lay the spine from top to bottom, slowly back down. Let your natural architecture be felt on the floor as you land. Take a big breath in as you're there, and take a big emptying breath out. And leaving your feet as they are, just let your knees fall to the right. If you need to wiggle and shift a little bit, do so. Couple of breaths here. And eventually let your knees fall to the left. When you're ready to unravel this, just come to center. Give your knees a squeeze in. So wrap your arms around your legs, round your forehead toward your knees. Take a big breath in. And as you breathe out, let it all go. And just get comfortable on your backside. So if it's not comfortable to have your legs straight out, keep your knees bent. If you'd rather lie on your side, you can do that. Let your palms face up so that your arms are easy. Let your grip release from your hands. With your eyes closed, just sense and feel the weight of your head into the floor. Just with this overall awareness of the body traveling down, just notice the space between your neck and the floor. Feeling that curvature of the spine, the cervical spine. Traveling down into your thoracic spine, is feeling that connectivity between the thoracic spine, where the ribs are connected, the shoulder blades. Do you sense anything different from the left shoulder blade to the right shoulder blade? Or the ribs on the left side compared to the right side? Feel the weight of your right arm into the floor. Keep your right palm relaxed. Feel the weight of your left arm into the floor. Keep your left palm relaxed. And sensing and feeling the lumbar spine, the gap between your lumbar spine and the floor, your low back, that pocket of air. Feeling the tissues all around the left and right sides of the low back. Notice if you sense anything different from left to right. And sensing the entire pelvic girdle. Feeling the connectivity, the touch of your glutes to the floor beneath you, your mat. Sensing the comparison between left and right sides. And with your mind's attention, just traveling down your leg bones to your knees, left and right. Traveling down your shins and the touch of your heels, your outer ankles on the floor. And just sensing similarities, sensing differences. Taking your attention to your breath here, I'd like for you just to be in some really soft, expansive belly breaths. So taking really big, full inhales, letting the belly expand, and then letting it contract and soften as you breathe out. And here too, feeling the musculature, so there's a certain contraction when you inhale of the respiration muscles. And as you breathe out, do the same attention to the release that we were doing in other actions. So letting the musculature of breath release slowly on the exhalation, noticing if there's any jagged points in the release, any skips or sudden releases. Just see if you can get that really smooth. Keep doing this and let your exhale breath be even longer. So maybe doubling the length of the exhale breath. Just a little regaining conscious control of the musculature on the exhalation. Nice and smooth, nice and full, nice and long. And when you're ready, letting go of any control of your breath at all, letting any control of your body at all, just let it fall away. Sensing the heaviness in your body, the easiness in your breath. When you're ready, just slowly making your way to a side. You can pause there a little while if you want. If you'd like to take a longer final rest, just hit pause and do that. If you're rolling to your side, just take a couple of breaths there. And eventually make your way on up to whatever comfortable posture works for you. And just taking a moment to intentionally organize your spine, so feeling how you're holding your shoulders, your head, your ribs and pelvis. And just taking a few breaths here, just inviting the brain to just fully sense your body in space right now, to fully sense how you're breathing. Just remembering that this attention, this brain attention, is such a huge aspect of our rebalancing. If you'd like to take your hands together here at your heart center, please do so. Just take a big breath in and let it go. And the light within me sees and honors the light within all of you and within you, Dave. Hope that felt good. Great. Hope you guys have a fantastic rest of your day. Thanks for doing this, and I hope you feel better after doing this. I hope it brings you some sort of relief. It may be something that you revisit time and time again. If you're having any sort of discomfort in your body, you might do that. We're going to do 2 more classes at least that coincide with this one. So again, this one really targeted the trunk and the breath. We're going to take that and layer on special attention to the upper extremity and then special attention to the lower extremity. So let me know if you have any questions, if you have any special requests or needs. I'd love to hear, and we look forward to seeing you next time. Thank you.
Have a good one.